Thank you all for joining us this morning. My name is Helena Chang. I'm the Community Connections Program Coordinator here at the Center for Independent Living here in the East Bay. I'm really excited to be able to bring you this panel today to share what our Bay Area transit agencies have been doing to keep our essential modes of transportation safe, clean, and accessible. We have panelists from BART, AC Transit, Capital Corridor, and SFMTA, as well as from a transit nonprofit, Seamless Bay Area. Our panelists will share their knowledge on how public transit is safe for riders, as well as how we can work towards a more seamless and inclusive transit system for the future. Each panelist will have 8 minutes to answer the following questions. What steps are their transit agencies taking to reduce the spread of COVID-19? How do these steps keep accessibility in mind? What are important ADA and accessibility-related regulations that have been implemented? And what is the best way for customers to contact their agency for concerns or complaints? Seamless Bay Area will then share some of their thoughts and principles for what the future of public transit should look like and ways to support public transportation. The last 15 to 20 minutes will be public Q&A, where we answer questions submitted by audience members at registration and via the Q&A tool on the bottom center of your video window. Our first speaker is Bob Franklin, who is the Customer Access and Accessibility Department Manager at the Bay Area Rapid Transit, or BART. Take it away, Bob.
Okay, thank you very much. I'm just going to share my screen, my presentation. Okay, good morning, everyone, and thanks for joining in today. So my presentation will be on taking BART during COVID. So this first slide is just a orientation of the BART system that shows our 48 stations. So the way one way that BART communicates during COVID is on its homepage of bart.gov. At the very top of the homepage, there's a service advisory about all the changes that are occurring during COVID. So if you click on this top link, it takes you to all the COVID updates, one thing that's very important here is the trip planner. We are making changes as trains become more crowded. We do add additional trains. So it's really good to plan your trip to get the latest. So we have a trip planner there, as well as alerts that you might want to be aware of, as well as ridership information. So some initiatives that BART has taken is the airflow through the BART trains. The air in the BART train turns over at least every 70 seconds, including door openings, we have 2 or 3 doors per car. So one of the pictures in this slide is the airflow of the BART train. So, and we've also added improved air filters. So as this air is circulated, we take out any particles just to have cleaner air. We also clean the stations and all touch points several times throughout the day. So anything that passengers generally touch, our crews are cleaning. We've added a lot of cleaners despite the lower ridership. So we're cleaning the stations a lot more than they ever have been. The cars are also fogged each day. One of the pictures on this slide is a gentleman fogging the inside of the train car to get anything that has remained on the train cars. We have another initiative is we're selling personal hand straps, if that's helpful to you. So you don't have to hold on to anything that other people may have touched. If you need that, it is available. We have closed some portals, and we've labeled them on the street level of where the nearest entrance or exit is into the BART station. This is to simplify things and make the station a little cleaner. We've also added longer trains at all times, so just to encourage social distancing. And we've practiced, all of the frontline employees have the PPE equipment. Hand sanitizers are available in each station. The next slide shows how you can determine what type of crowd is on each train. So there are crowding charts. So you identify your line that you take and you click on it, And that opens up to this mostly green slide that is shown. And this shows how many people are on each car by time of day and by station. So this snapshot, you can see the vast majority of the time, there's less than 10 people per train car. At its peak, we had about 200 people per train car. So there's plenty of space. The crowd, this slide shows where the crowd is. And it's usually the morning commute on the Pittsburgh Bay Point to San Francisco line, the middle of the system. That's where the crowd is. Most other times there's a lot of space. And then the next slide shows, this is the peak of the crowds. So on the Antioch to San Francisco line, it gets to about 30 people per train car, and all other times there's a lot of space. I took a couple pictures of what that looks like. So the first is, this is the peak. This is about 30 people per train car, and people are pretty spread out. There's about 6 feet between people. They stagger within seats. And then the next slide shows what it's usually like. And this is 10 people. And then there's plenty of space for each person. For taking elevators at BART, we currently have 2 signs in the elevators, and they are depicted here. One is that face coverings required, and the other is to maintain social distancing. So at BART, we've opted for a generic message to maintain social distancing, and then let people figure it out for themselves, because there's so many different scenarios. So instead of saying you stand here or you don't go in this area, we just wanted to encourage social distancing. Frankly, some people did not like this about elevators, and this was brought to our accessibility task force meeting last month. And we are in the process of making a change to enforce 1 person or party in the smaller elevators at a time. So there's some other tips when riding elevators: to face away from others if possible. And then if you touch buttons, to be cognizant that you should use a sanitizer. Some etiquette when taking elevators at BART: to take the elevator or stairs if that's an option. If there's a line queuing up and you have that ability, that takes some of the pressure off the elevator and makes it for those that need it most. And we are going to be having signs that to yield to some priority groups. And then some icons here are a person in a wheelchair, a person using a cane, an elderly couple, and a pregnant woman. Some additional elevator information is a good idea to check the status of the elevator in advance. There's plenty of ways on BART.gov to do that. I have just 2 minutes left, so I'm going to speed it up a bit. The elevators are cleaned throughout the day in downtown San Francisco. They have attendants, and if more than 1 person enters that elevator with the attendant temporarily gets out. There's a good airflow in the elevator with an overhead fan as well as openings. And if there's an incident at BART where there's an elevator with a COVID case, that elevator is fogged to clean it further. We are encouraging contactless payments, so you don't have to touch our fare collection machines. And that's available through a Clipper card or an RTC card that you can apply at any transit agency for that. Our paratransit operations have similar protocols where your face coverings are required. There's 1 group per paratransit vehicle at a time. They're constantly cleaned, and there's some wellness screening before while a person is making an appointment. And if you would like to participate in latest updates and new initiatives as we change our service, BART's in a severe budget crisis right now, so we may be faced with changing our hours, changing the stations that are open. So these will all be discussed in public meetings, either the BART board meeting. Well, there's always going to be budget updates and new COVID initiatives. Those are generally the 2nd and 4th Thursday of each month, as well as the BART Accessibility Task Force meeting, where accessibility issues are offered and discussed. There's currently two openings on this task force. There's a picture on this slide of the Zoom call where how we currently host these meetings. So it's easy to get to as opposed to coming in person, and it's open to the public. So that's my and then one more slide is just my contact information. It's available on BART.gov, and thank you very much.
Thank you, Bob, for the presentation. As a reminder, we will be fielding all Q&A questions at the end of the panel, but feel free to type in your questions and concerns as the presentations continue. Next, we have Chantal Reynolds from AC Transit.
Good morning. My name is Chantal Reynolds. I'm an External Affairs Representative at AC Transit in the Legislative Affairs and Community Relations Department. Kimberly Ridgway of our Accessible Services Department is here in the webinar with me this morning. Thank you for having us. AC Transit provides an essential public service. Nothing is more telling of this than what has transpired as a result of the COVID-19 coronavirus. Since the economy has shut down, we have been providing a critical service. We get many of the essential workers and the public to and from work, hospitals, doctors' visits, the grocery store, and much more. In fact, these pre-pandemic numbers show what a critical service we actually provide. 11% of our riders are seniors and or have a disability. 64% of weekday trips were to and from work or school. 89% of trips were to and from riders' homes, and 42% of our trips were made by riders who have no access to a vehicle. Next slide, please. Now, here's some more pre-pandemic numbers. AC Transit operates 151 bus lines throughout a 364 square mile service area from the San Pablo Bay to Fremont. We serve 1.5 million people in 13 cities and adjacent unincorporated areas in Alameda and Contra Costa counties. We provided 175 rides each weekday on average. We had over 14,000 daily Trans-Bay riders. We also made about 771,000 paratransit rides annually. We have a fleet size of 640 coaches. So, as you can see, we play a critical role in the Bay Area's transportation network, connecting with 16 other public and private bus systems, 25 BART stations, 6 Amtrak stations, and 3 ferry terminals. We also have facilities in Oakland, Emeryville, Hayward, and Richmond. We provide service across 3 Bay Area bridges, the Dumbarton, the San Francisco-Oakland Bay Bridge, and the San Mateo Bridge. Next slide, please. Now here's a look at our pandemic ridership numbers. As you can see, the pandemic has had a crushing effect on our ridership. Our ridership numbers began to dip in March at the beginning of the pandemic. Our lowest ridership numbers were in the month of April, with only about 50,000 riders. As we provide an essential service, you can see that there has now been a steady increase in our ridership over the past few months. However, current ridership is still a fraction of what it was pre-pandemic. Next slide, please. At the onset of the pandemic, we had an initial drop of 74% of our overall ridership, and we are currently around 57% to date. Our Trans-Bay service took a huge hit, and our ridership dropped by 96%. Due to the significant drop in Trans-Bay ridership, we are currently operating a limited number of Trans-Bay routes. We are currently operating overall at about 75% of pre-pandemic service levels. We did, however, maintain our trunk route frequencies and service throughout disadvantaged neighborhoods. Next slide, please. So what we have done since the pandemic to mitigate its effect on our service. AC Transit has taken the COVID-19 pandemic response very serious, and we have tried to go above and beyond to protect and ensure the safety of our passengers and staff. We sanitize our buses daily with antiviral sprayers and foggers that clean fare boxes, clipper card readers, handrails, stanchions, seats, bus operator compartments, stop buttons, pull cords, and other hard surfaces. We also sanitize all AC Transit facilities to ensure staff safety. We provide personal protective equipment to our staff, which includes gloves, masks, and sanitizers at all facilities, including individual use bottles as well as dispensers. We have provided COVID-19 education to our staff as well. Next slide, please. Some of the other changes we have implemented in response to the pandemic impact riders directly. Initially, we implemented rear door boarding and free fares to prioritize safety of operators and riders. All rides beginning on March 23rd were free. Fares have since resumed October 19th. In fact, each month that AC Transit did not collect fares, we lost about $5 million. So over the 7-month fare-free period, we lost about $35 billion in total. Passengers requiring passenger ramps or needing priority seating were allowed to continue to use the front door. Wheelchairs are secured upon request. Masks are required on board and at bus stops at all times. We have complied with CDC and state and county standards of maintaining a 6-foot social distance. Adhering to the 6-foot social distance requirements has led to the following capacity limitations on board. 30-foot buses are limited to 6 passengers. 40-foot buses are limited to 10 passengers. 60-foot articulated buses are limited to 16 passengers. Once capacity is reached, the operator will change the head sign to drop off only. At that point, no additional riders will be allowed to board the bus. Next slide, please. AC Transit has taken its response a step further and has implemented our Renew plan. This plan is a multi-pronged action plan outlining AC Transit's commitments to ensure safety of employees and riders and includes 4 key components: health and wellness, service and operations, communications and engagement, and technical innovations for recovery. We have adapted to the pandemic by deploying these demonstrable upgrades. We provide free onboard PPE for riders. We have outfitted all AC Transit coaches with hand sanitizer and mask dispensers. We have filtrated and now have cleaner air on board our buses by installing high filtration by the HVAC manufacturer, which removes particulate matter as small as 3 micrometers, circulating fresh filtered air every minute and 20 seconds. We've also installed plexiglass bus operator shields, which limits the spread of airborne droplets from coughing, sneezing, or speaking. We've expanded contactless payment options and launched our new mobile app just last week, which includes options to purchase fares. We have had passenger health and safety awareness communications, which include informational materials on our buses, rider communication via e-news and text messages, social media posts, a dedicated web page. We've sent press releases and email communications to elected officials, stakeholders, community-based organizations, and other community partners. People can also visit or call our customer service center for additional help. Next slide, please. In our efforts to go above and beyond to keep our riders and staff safe, we have also joined in regional efforts by collaborating with other agencies on the Riding Together Bay Area Healthy Transit Plan. In this plan, we have agreed to and develop common, adaptable, shared baseline metrics for health and safety protocols and commitments to reduce transmission across systems. This plan was developed by Bay Area transit operators throughout the 9 Bay Area county region. The plan is tied to the state's pandemic resilience roadmap. We share common commitments like state mandated face coverings, safe distancing and capacity, daily cleaning and disinfecting, provide PPE for employees, ventilation on coaches, and touchless fares. Partners include BART, SFMTA, Caltrain, Samtrans, the SF Bay Area Ferry, WIDA, and many other transit agencies across the region. Operators report monthly to MTC on their progress with elements of the plan. More information, including the accountability data sharing dashboard, can be found at healthytransitplan.com. The Bay Area transit operators are now gearing up to launch a region-wide rider survey, which will help inform an upcoming marketing campaign focused on getting riders back on transit when the economy opens back up. Next slide, please. Next slide, please. So in closing, here's how the public can contact AC Transit to provide customer feedback. Next slide, please. You can always also visit our customer service center. The temporary location opened on October 12th and is located at the AC Transit general offices in the lobby. Our main customer service center is undergoing renovation and is expected to be open early next year. Next slide, please. Kimberly and I can be reached at the following numbers and email. I'd like to thank Kimberly Ridgway, a Senior Program Specialist at AC Transit, for helping me with this presentation today. With that, she and I will be happy to answer any questions later on in the program or offline at the information provided above. Thank you for your time.
Thank you, Chantal. And this webinar will be recorded, so if people need to find these numbers later on, it'll be on the CIL's YouTube channel. Next up, we have Leo Sanchez, who is the Capital Corridor's Deputy Managing Director.
I'm Leo Sanchez with Capital Corridor. Our service operates from Auburn down to San Jose, and we do operate a 7-day service. Our ridership has still stayed relatively low compared to where we were last year. We're hovering somewhere around the 15 to 16% range on the weekdays, and it's similar on the weekends. A couple of things to note is that we did reduce our service significantly. So normally we operate 30 trains a day, and beginning June, we began operating 16 trains weekdays and 10 trains on the weekends. So this is about a 45% reduction of our normal service pattern. So a few things that I wanted to highlight is this screen, this next slide shows our website. And on our website, you will find information about health and safety tips. We also have a video with audio that you can see or listen to, and it'll take you down a narrative of what are the specific guidelines that we're following and some of the health and safety initiatives that have taken place on Capital Corridor. So I'll highlight a few of them. We are requiring, as just about everyone is, mandatory face coverings. We're also have implemented and installed hand sanitizer dispensers aboard all of our trains. So you'll find 2 of those on each rail car as you take our service. And then a few other things that we're also doing is we're also sanitizing high frequency touch points, as well as similar to BART, we're also fogging our cars daily. And those are just a few of the things that we're doing to keep everyone safe. So again, here are a few of those snapshot items that we're covering. And similar to BART, we've also have a tool that will help everyone in being able to keep themselves spread out and safe as we start seeing some of our ridership increase again. As you can see, these are the trains that we're operating throughout the day, and the high peak points are just above 20%. So we're still really, really spaced out, and we're still far below the 50% capacity that I believe everyone is observing still. The next slide that I wanted to cover is that we are trying to do more to engage our ridership, our riders. And so one of the things that we've done is, number one, we've done a survey to try to get a gauge of what is it that our passengers want to see of our service, especially during this difficult time. And as you can see, some of the main high hitters that we see on here is about social distancing, masks, the cleanliness, all of which are areas of focus for us. The next point that I'd like to highlight is that we are also trying to engage our riders, and I welcome everyone to join on our corridor conversation. So we did this last month for the first time, and it was actually very, very successful. We were able to highlight a few of the initiatives, and some of this, if anyone here joined, some of the slides here are similar to what was covered there. And we try to build engagement with our riders and have our managing director, Rob Padgett, as well as some of the other staff members with CCJPA come on and just talk about what we're doing to keep passengers safe, to encourage safe travel, and to maintain this critical service that we operate. Sorry about that. I'll just highlight a few of the corridor projects Capital Corridor projects that you'll find on our service. So we are enhancing some of the LED lighting throughout our stations, particularly Martinez and Richmond were completed. So, this is also just to keep everyone safe, and, especially during the dark days that are now, upon us with fall and winter looming. And then a really nice feature that you'll find aboard our trains is that we did install the next generation Wi-Fi, and you'll see that throughout most of our cars now. We should be completed by the end of the year, and this will be roughly show you about twice the speed that we previously had. So it's a nice feature that is provided to all of our riders. Here's another way to stay connected with us. So we are on Facebook, Twitter, and Instagram. Thank you, everyone, and feel free to reach out to us. You can always connect with us on any one of those platforms. You can also reach us at our website if you have any type of comments or concerns. With riding with us, we do have our website available to you, which you can find at capitalcorridor.org. Thank you.
Thank you, Leo. Now we have Matthew West, who is the excuse me, who is the accessibility planner for San Francisco Municipal Transportation Agency, or SFMTA.
So my name's Matthew West, and I work in the Accessible Services Department with the SFMTA, which, thank you, which runs the Muni system in San Francisco. So mainly what steps we're taking to reduce the spread of COVID are very similar to what other agencies are doing. We've increased the cleaning of our buses. We have mandated social distancing both on board the buses with limits on how many passengers can ride, and instructions to our drivers that when the bus becomes too full, they're to skip stops until the bus is back at a safe load again. And then also at our bus stops, we have actually designated waiting areas at each of our major bus stops, showing where to wait, as well as showing where the accessible boarding location is, which basically is where the front door would line up. We also require masks on board at all times, and we also require everyone to board through the back door unless you need the lift, the ramp, or specifically the assistance of the operator. So some of the pictures are, we have some media on the buses showing that you need to stay physically distanced between passengers. We have a picture of someone cleaning the buses. We have a picture of our sign that we have on the actual bus itself, directing passengers to the rear door, unless you are needing that front door to access the ramp or operator assistance. And then we also have a picture of one of our major stops on Market Street that kind of hard to see, but there's an orange box that someone's standing in, and that's actually designating the accessible boarding location. And then there's other little hash marks further down that show where other people can stay or stand. So one thing that all of these changes have done is it's really challenged our ability to provide the same level of service that we were doing before. Our vehicle capacity system-wide is limited to approximately 30%. So it's stretched very, very thin. Also, before the pandemic, we used to actually change operators in the middle of a line. So this was called a relief point. But if you'd ever ridden on Muni, sometimes you'd get to a stop and you'd stop there for a few minutes and you'd notice the drivers would change and then the bus would go back in service and continue on its way. Well, since we are cleaning every single bus multiple times a day, we no longer do that. We actually, when the driver is done with their shift, they actually drive the bus back to the yard and it gets cleaned and then gets driven back out. So because of that, we actually don't have, every single operator basically is a bus. We don't split buses with operators anymore. So every time the operator gets to the end of the shift, they have to take that bus back to the yard. And then also we do not run any rail service currently. So we do have buses that cover the same basic routes like the K, the J, the L, but there's no rail service and all of our underground stations and all the elevators are all closed. In a nutshell, what this means is that in order to just provide the same level of service that we had before COVID, it takes 3 times as many buses and 3 times as many operators. So it's a lot of service, a lot of changes as far as being able to provide just the basic services. And what this means, which is kind of how we've what this means is that our actual service has been drastically reduced. Of our roughly 54 transit lines, we're currently running about 17. So we've actually cut service very drastically, and we're calling this a core service plan. And how we've tried to keep accessibility in mind in making these service cuts is that we have really focused on our major corridors, really focused on the lines that before, there was a little brief snippet where we were told to shelter in place, but we hadn't yet gotten instructions on what to do as far as making buses safer. And so we actually looked at the ridership during that time and what were the most popular lines during that time that people were still using, even though they were sheltering in place. Looking at citywide geographic distribution and essential destinations such as hospitals, grocery stores, stuff like that. So in a nutshell, our service plan, if you were able to, the map here is showing basically, for those of you not familiar with Muni, it's basically our most used and heavily used lines, the lines that get you across town, both east, west, north, south, as well as a few not as heavily used lines that connect neighborhoods between each other. What you'll notice is missing is all of our community service lines, many of the lines that just went through neighborhoods and might have connected to one or two other areas. And then you'll also notice that there's some lines that have been modified where we're running part of a line, but not the full line. One thing we also did when developing this was we actually took in our equity strategy. So the Muni equity strategy is actually something we developed and we updated about every 2 years. It builds on the requirements in Title VI. It's a neighborhood-based approach that addresses accessibility to neighborhoods, to buses. It also looks at making sure that the system is distributed evenly throughout, that that richer parts of town are not getting more service. And it ensures that basically everyone that needs to ride the system and wants to ride the system can. So what you can see in this is that the majority of our equity neighborhoods are concentrated on the east and south of the city. And in the map shown before, you would notice that most of the transit is in the east and south of the city. So that's kind of how we've tried to build that into it. We also are slowly expanding our core service as we're able to get more and more service out there, and we are continuing to work with the community on that. So we're continuing to use our equity strategy, looking at feedback from passengers, the connectivity of different neighborhoods, connections to essential destinations that we might not have caught the first time around, looking at the loads on each of our buses to make sure that we're still maintaining those safe loads, and then also operator feedback. And that's all going through 311, elected officials, and also community engagement events. As far as specific accessibility regs, basically what I'm highlighting is some of the exceptions. So as I said before, all the passengers are really being encouraged and instructed to board through the rear door of our system, but there are some passengers that still need to board through the front door. So we have specific notices to our operators and specific communication saying you are allowed to board through the front door. If anyone is hanging out at the front door, take their word that they need to board through it and just let them on. We also, for operators, are really encouraging them to stay in their cabins. So we actually have a shield up and we're instructing them really to not get out of that driver's area. But if you do need operator assistance, such as riding with a mobility device, we do have a very detailed notice that talks about the types of mobility of securement systems we have on board. It does encourage the use of our passive restraint if our buses are equipped with one, and that is a rear-facing securement. And the reason we're really encouraging it is that there's no real physical contact at all between operators or passengers. That if you get in that rear securement, you back up against this big pad that looks kind of like an ironing board. And once you're back up against that, there's a bar that you can pull down yourself, and then you just set your brakes and you're good to go. So there's no securements. But if you did want securements, the operator is instructed on how to assist you with that while keeping a safe distance. The other big thing we've done is, knowing that we cut service so drastically, we've worked with our partners in the taxi industry to develop an essential trip card program. So this basically is a taxi subsidy for 10 essential trips, like going to the grocery store, pharmacy, medical visit, all within San Francisco. And it's open to all seniors age 65 and above, anyone with a disability, as long as they are a San Francisco resident. I'm going to see if I can get this video to work just to tell you a little bit more about it. And then
the coronavirus pandemic has made it harder to get to the grocery store and to medical appointments. But the SFMTA's new Essential Trip Card is here to help seniors and people with disabilities pay for a taxi to complete an essential trip. It's easy to get signed up. If you are 65 or older, or are a person with a disability, you can apply for the Essential Trip Card by calling 311 and mentioning the program. After you sign up, you will receive a debit card in the mail. Before taking your first ride, you'll need to load payment to your card online, by phone, by mailing a check, or by arranging to pay in cash. Paying $6 gets you $30 of value, or you can pay $12 to get $60 of value for essential trips you take in a taxi. To hail a taxi, you can call by phone, use the Flywheel app, or just flag a taxi on the street. You can find a directory with taxi dispatch numbers on our website at sfmta.com/taxi. Taxi drivers are required to wear face masks or face coverings, clean frequently touched surfaces in their vehicles between trips to limit risk to both riders and drivers, and have been provided a CDC-approved sanitizer. We're asking riders to do your part by washing your hands thoroughly before and after taxi trips, and by wearing a mask or face covering and to avoid touching your face. All San Franciscans are expected to follow the health order and only take essential trips. Your card can help you go on an essential trip anywhere in San Francisco. The SFMTA is thankful that taxis continue to deliver critical services to our most vulnerable San Franciscans during these challenging times. Learn more about the Essential Trip Card at sfmta.com/ETC.
And the big thing I want to stress with the Essential Trip Card is that you can still use Muni while applying for it, that it's not an either or. So it's more of just another tool to get you where you need to go if you feel more comfortable using that tool. And as the video stated, for every $6 you load on your car, you will receive a $30 value up to a maximum of $60. San Francisco being so small and this being limited to the city and county, that actually covers a fair amount of the city. Our average taxi trip is about $10 if you go from one end to the other, 10 to 12. So that gets you pretty far. And then to qualify for the program, customers must be a San Francisco resident who's 65 or older or have a disability. And then as far as best way to contact me, you can contact me at my emails, the best right now, which is Matthew, MATTHEW, .west, WEST, at sfmta.com. Or you can also call 311. If you're in the city, that is just dialing 311 on a telephone. If you're not in a city, or if you actually are using a captioning system, not captioning, if you actually require ASL, you need to dial the full number, which is 415-701-44, or, whoa, sorry. That's my phone number, which I'm not at the office now, so that won't work. You actually dial 415-701-2311. And that's my son making a quick little debut. But once again, it's 415-701-2311. Thank you very much. And I'll take questions later on.
Thank you, Matthew, and hi to your son. Lastly, we have Ian from Seamless Bay Area.
My name is Ian Griffiths. I'm the policy director of a nonprofit called Seamless Bay Area. and we are a rider-focused nonprofit, and our mission is to transform the Bay Area's public transit system into a world-class, unified, equitable, and widely used network by building a diverse movement for change and promoting the policy reforms that can create that integrated system. And long before COVID, we were talking to riders across the Bay Area, and hearing that so many residents want a far more connected network, observing that they would like to use transit more, but too often it doesn't take them where they need to go. It doesn't provide the reliability or the frequency that they need. Sometimes it can be confusing to navigate so many different systems. So our vision, and this slide shows a map of a connected network across the Bay Area of integrated lines. Our vision is to create a connected, seamless network that's strategically planned at a regional level to actually work as one system, where transit agencies work together to operate different parts of that network. And that means that service quality, fares, schedules, wayfinding, and importantly, accessibility practices are standardized to be reliable and as simple as possible for users. This also means that paratransit service, as part of this, would be seamlessly integrated across the region as a whole. That's our vision. And of course, COVID has changed a lot. We heard about some of the ridership declines across the Bay Area. This image on the right-hand side is showing the 27 different transit agencies that have all experienced serious challenges with ridership. On the left-hand side, the different declines in ridership for the 7 largest agencies, ranging from 89 to 94% ridership declines on BART and Caltrain to 58% on AC Transit, 79% on SFMTA. So overall, about 75% is the average declines in ridership. And this has forced transit agencies into making service cuts and presented major financial challenges that threaten the long-term future of transit in the Bay Area. MTC has estimated, MTC is our regional transportation coordinating authority for the 9-county Bay Area. And they reported at a meeting earlier this week that they estimate there will be a $2 billion shortfall in funding for public transit over the next 2 years. And this is over and above the $1.3 billion that the Bay Area has already received in federal relief funding through the CARES Act that was approved. So already these service cuts are having a devastating impact on people's lives, but they could actually get a lot worse if we don't find additional funding to fill that gap. Of course, there are many people still using transit. 75% of riders are not using transit, but that means 25% are still using it. And many of those people are essential workers, as well as studies and surveys have shown that they're more often to be transit dependent groups, including seniors, people with disabilities, and youth, as well as low-income people, women, and people of color are all taking transit as a higher percentage than even before COVID of all passengers. So in response to these changes and these crises, we have seen, one of the encouraging things is that transit agencies have been working together like never before. And I'm certainly grateful to all the representatives on this call for their efforts to adapt and respond and make transit safer. One of the other things that has been done is that the region has set up what is called a Blue Ribbon Transit Recovery Task Force of transit agencies, advocates, elected leaders, and state representatives that is focusing on coordinating the recovery strategies across all of the different agencies, including on health and safety. They're coordinating their efforts to advocate for additional funding to help us ensure we don't have to make future service cuts. And they're also looking now at how they can reform transit so that we can actually rebuild a stronger and a more connected system than we had before, recognizing that many people, especially advocates, we don't want to see the system rebuilt just the way it was before COVID. We feel like there were problems with it. Now we should be focusing on how we can position ourselves for a much more connected, seamless, and equitable system than we had before. This slide is showing the initiative to create the common health and safety plan for all the agencies. www.healthytransitplan.com is the address for that. And this is where each of the agencies is reporting on what levels of, all the practices they're doing and what percentage of people are being observed, complying with the universal mask rules, which, and other metrics associated with the Healthy Transit Plan. So we're happy to see that development. However, we also feel that many challenges still remain in terms of health and safety and coordinating all of our different systems and the service cuts that are going on that impact riders' lives. We feel as Seamless Bay Area, we need to build off of this collaboration, but make it more just the way we do business going forward. Coordination shouldn't be something we only do during pandemics. It needs to be all the time. It needs to be institutionalized and streamlined. And without, a guiding plan for how our network is supposed to stay connected, we could see as more and more service cuts happen, we could see the gaps in our system and in our network becoming even greater unless we change the way that we fundamentally organize and run our transit system to ensure connectivity and access. Seamless Bay Area has wanted to hear from riders about what they've been experiencing to guide our advocacy. And we've teamed up with a number of different nonprofits to host 2 different rider forums over the past 6 months to hear what riders' experiences have been. One was focused on rider safety, and another one last month was focused on service cuts. And some of the things we heard from riders who attended those forums, we had several dozen at each of them from across the Bay Area. In terms of rider safety, we did hear from riders that many people have noticed the cleaner vehicles and are happy to see most people complying with mask wearing, though some people did observe that sometimes that doesn't, they do observe some people that have not been wearing masks, and that's one of the primary concerns that people continue to express. And then also frustration with pass-ups. I don't know how often these are occurring now, but certainly at the beginning of the pandemic, vehicles that were full, didn't stop to pick up passengers, and that was creating a lot of frustration for riders. And then the more recent forum we had on service cuts, some people expressed the impact of these service cuts on their lives, taking longer to get to where they needed to go because they had to walk further in order to get to a bus. Some people expressed that they were now considering buying a car or a second car because they no longer could rely on transit as much as they used to. There were some people who expressed happiness with the level of information that was provided by agencies, but also many who expressed frustration about the lack of information that was provided on service changes. And particularly, some people expressed that it wasn't provided for people with disabilities or in the forms that people who needed that information could get it. So, across the board, riders expressed that if these temporary service cuts became permanent, it would really have very drastic consequences on people's ability to get around. So, to guide our advocacy, I wanted to share, and this was something that started before COVID, it's continuing to guide our advocacy moving forward. We launched a set of these 7 seamless transit principles that we think should guide how we reform our transit system moving forward. I'll read them briefly. They are 1, run all Bay Area transit as one easy-to-use system. 2, put riders first. 3, make public transit equitable and accessible to all. 4, align transit prices to be simple, fair, and affordable. 5, connect effortlessly with other sustainable transportation. 6, plan communities and transportation together. And 7, prioritize the reforms that can actually create this seamless network. We need to do more than just talk about it. We need to make it, we need to reform our agencies and the way we work together to ensure that this becomes the way we just do business as a transit system. So lastly, I want to close with some actions that you can take to help save transit, to ensure that we still have it, and to ensure that as we adapt to this situation, we can rebuild a much better system than we had before. So the first is really that the most urgent issue is funding, that $2 billion funding gap that I mentioned before that is potentially facing our region. And the biggest chance we have of filling that gap is action by our federal representatives. So your vote in the upcoming election is really important. Please look into which parties are supporting additional transit funding, and please speak to your elected leaders that advocate in Washington regarding supporting transit funding in any future relief bills. If you sign up for Seamless Bay Area's mailing list at www.seamlessbayarea.org, we'll keep you informed about opportunities to speak up and when that's going to be most effective. Keep you informed of any bills that could include additional transit funding. Another thing that you can do is to sign the Seamless Transit Principles as an individual, or if you represent an organization, endorsing it as an organization, if you support those 7 goals that I read out before. This can ensure that we help show transit agencies and our region that we want to rebuild a better network than we had before COVID. So you can do that also on our website or at the link, the URL, seamlesstransitprinciples.org. And we'll keep you informed about opportunities to speak up, as well as any future rider forums that we host. We haven't committed to any yet, but we may well host more like the ones that we had, where we'll invite users to talk about their experiences. These Seamless Transit Principles have been endorsed by 27 different organizations across the Bay Area and 6 different cities and counties, including the County of Alameda and the San Francisco County Transportation Authority. And then lastly, on the ballot, I want to highlight 2 important measures that you should be aware of. So across California, everyone will be able to vote on Prop 15, which would basically, as stated here, would require, if passed, it would change the assessment of commercial industrial properties, the tax rate for commercial industrial properties. And if passed, it would, one of the things it would do, it would provide additional funding for some of our main transit agencies, including $45 million extra for SFMTA, $30 million per year for AC Transit, and $5 million per year for BART. So while there's no transit explicitly in the measure, if you read it, the reality is this would actually have significant benefits for the near term of some of our most important transit agencies. And the other one I want to highlight, if you live in San Francisco, San Mateo, or Santa Clara counties, is Measure RR. This is an 8-cent sales tax in those counties that would specifically fund Caltrain, providing $100 million a year of dedicated funding for that service, which currently lacks any dedicated funding source and is under real threat of shutting down completely if it doesn't get a dedicated source of funding. So I would encourage you to vote yes on both of those measures if you haven't already cast your ballot, or to watch out for them. So with that, I'll put the link to those links in the chat, but otherwise I'll stick around for questions. And thank you for inviting me to this.
Thank you, Ian, for that information. I I know we are going a little over 12 already, so not everyone can stay. Feel free to stay for a few more minutes as we answer some of the Q&A questions. But if you can't, do note we will be sending a follow-up email with the contact information of the panelists and their agency for those who called in or are not able to view the slides. There will also be a feedback survey that we would really appreciate if you can fill out so we can make sure our webinars can be better and accessible for everyone. There'll also be an option in that survey to bring up any additional questions that you weren't able to ask today. So you could put the questions in the survey with your contact information and we can get back to you on that. So now we'll quickly go through some Q&A questions. There was one regarding elevators for BART, and someone asked, do elevators still have volunteer attendants inside to help make sure it's clean? We did answer that in the Q&A box, but for those who may not be able to click into the Q&A, the answer was the 4 downtown SF BART and Muni stations still have elevator attendants at all times. They are paid and work for the nonprofit Hunters Point family. Let's see. Another question that came up is how many times a day are buses cleaned? Would Muni and AC Transit want to clarify that? I guess Chantal, would you want to go first?
Hi. The buses are cleaned each time they go back to the yard between schedules. So that is definitely a minimum of once a day, possibly more, but I can get a definitive answer back to you guys for that. But I do know definitely, of course, as we mentioned, once a day, but they have to get back to the yard. So that's pretty much, yeah, I can get back to you on that.
Okay. And Matthew, do you have numbers for Muni?
I'd have to get exact numbers. I believe they are cleaned at the yard before they pull out. They're cleaned when they pull back in the yard at the end of the driver's shift. I know we do have some mobile cleaning units that do go out, but I don't think they are able to get to every bus. So I could find out more about that, but I know that definitely twice if you're looking at from when they start service to when they get back. So kind of once at the beginning, once at the end. And on our major lines, probably once again while they're in service by a mobile cleaning unit.
Thank you. Another question is someone is concerned about droplets hanging in the air, not just on the surfaces. Would any transit agency like to respond to that?
This is Leo with the Capital Quarter. What I could say is that, and I know this kind of ties into another question that was asked that I don't have an answer for immediately, but I can get back. And we are fogging the rail cars daily, and it actually happens on every turn. So for droplets suspended in the air, hypothetically, that's really what the intent of the misting or fogging is for. And I can get back to the question about what chemical is used. I know that was part of that question.
Someone asks, I remember there was some information about wheelchair securement, but can't remember which agency who said it. Drivers, they say that drivers instruct the riders, or is it their attendants?
I can answer that one. I think it was me.
Okay.
Matt, yeah, so it's Matt from SFMTA. What the presentation was saying was that our policy is to try to keep the drivers in their, in their seat driving the bus and not really interacting with the passengers as much. But as an exception to that policy, we have a specific notice that says if someone is in a wheelchair and says, I need to be secured, they are allowed to secure them. And then what we do is if the bus has what's called a passive restraint, which is a rear-facing restraint system that doesn't use any belts. Basically, you would take your mobility device against a very big surfboard looking thing and then pull down an arm, and that would be you being secured. You would just have your brake on. The operator will encourage you to use that, but you are in charge of how you want to be secured. So you or your attendant could say, no, I want to use the belts. And then we've worked with our operators in providing them training on how to safely secure you with the belts if you request it, while still maintaining as much distance between the operator and you as possible. So that's the clarification. But you are always in charge of how you want to be secured. And on our system, if you refuse to be secured, we still actually allow you to ride. So the majority of people actually are riding, saying we don't want to be secured right now. And we still allow them to ride as long as the brake is set. Hopefully that answered everything.
Thank you, Matthew. Kim from AC Transit will now be answering some questions from the Q&A.
I actually wanted to also let everyone know that on AC Transit, it's the same as far as wheelchair securement, in that passengers will be secured upon request. There was also, I'm sorry, Helena, there was also a question in the Q&A about how often paratransit vehicles are being cleaned. And those vehicles for East Bay Paratransit are cleaned before the vehicles leave the yard, as well as between passengers. So right now, most vehicles have one passenger at a time until ridership starts to increase. And so once the passenger is dropped off and the vehicle is empty, then the driver will give the vehicle a cleaning before they pick up the next passenger.
Thank you for that clarification and for answering the paratransit question as well. Let's see if there are any more in the Q&A. From the registration questions, one person did ask, are seniors receiving free bus passes? Would any bus agencies like to respond to that?
This is Matt with SFMTA. We actually had a program before COVID that did give free muni service to seniors and people with disabilities age 65, or seniors age 65 and over, and any person with a disability, as long as they were low to moderate income. So that was actually fairly high. I actually have yet to meet someone who hasn't qualified for the program. I believe for a family of one, it was about 88,000 of yearly income was the cutoff. And then it goes up from there. You do have to be a San Francisco resident.
I see. Another question came up. Would any of the agencies at this point know what chemicals are used in the fogging? So I believe BART, AC Transit, and Muni all mentioned using chemicals on that, or in the fogging and cleaning.
This is Bob Franklin with BART. I've asked during this webinar for that answer, and I still haven't found out, but I will provide the person that asked as well as you, Helena, and if you can share that with participants, I'll provide that information.
Okay.
Hi, this is Chantal Reynolds with AC Transit. I'll do the same as well. I'll get that information to you.
That'd be great.
And same here from SFMTA.
Capital Quarter as well.
Another question is, what other formats of information is provided so persons can get up-to-date information? So other than like online, I guess this person is asking what other formats your agencies are thinking to spread awareness and information about what you guys are doing to make sure that transits are safe for people to ride on.
So this is Matt from SFMTA. We do have an ambassador program that's at many of our most heavily used stops, where there are people waiting at the bus stop with information about the service reductions, riding Muni, and can assist with any additional questions they have. We've only been able to deploy them at major stops, but that's one way of getting the word out, as well as printed materials on the bus, at bus stops, our website, and then at community forums such as this, or we also do have a accessibility advisory committee that we talk to a lot and then use their network to get the word out.
Would any other panelists like to comment on this?
And at BART, it's very similar to SFMTA. We also have an ambassador program, and our police department, we're focused on compliance, not enforcement of the rules. So everyone has, all of our staff have masks to hand out to ensure people are following the rules. And we also make audio and visual announcements in stations every 15 minutes.
This is Leo Sanchez with Capital Corridor. Similarly, we also are distributing face masks to those that need them, and the conductor facilitates that, as well as for anyone that needs further assistance. We do have staff stations at our most popular stops. So for example, Sacramento, Davis, Martinez, Emeryville, Oakland, all have staff available for questions and further assistance when needed.
Great. Chantal, do you want to comment? No, that's okay. We'll have one final question.
One time I was going through several of the questions. What was that specific question?
Just on how AC Transit is looking for other platforms on spreading information.
Right. So I definitely answered that in the presentation. So we spread information in several different ways. We send out notifications via email to elected officials, community partners, CBOs, and ask that they get the information out to people who may not be able to traditionally access information. We also have e-news, and that goes out via email, but it also goes out in text messages. And so those are some of the other ways that we are getting that information out. And again, our website as well has all the information, and that can be accessed at actransit.org. And then you can call the customer service center for those who may need more assistance, and they can provide that assistance at our customer service center. So they can visit there, they can call, and whatever needs they may have, we can also assist them once they do that, once they call the center.
Great. And then we'll finish with this one question. Someone brings up the idea of, can cleaning be tracked so agencies are aware, and where people can find this information as well? Would anyone like to comment on that?
This is Kim Ridgway with AC Transit. I need a little bit more clarification about, can cleaning be tracked? What does that mean?
Let's see.
Are we asking if agencies are keeping a log about cleanings?
I believe that would be the case.
Okay, because we do, I'm sure this is across the board, all agencies keep records of how often cleaning is done. And of course, when it comes to fogging, what kind of chemicals and all that kind of stuff. But at this point, I don't believe that it is public. So that would be a question I'd have to ask for our exec staff.
Got it. Well, if no one else would like to answer that question, I think we will end this webinar for today. Thank you all again for joining us. I know we went a little bit over time. Again, we will be sending out a follow-up email There will be a survey where you can provide feedback. And if you have any other questions that you'd like answered, you could definitely put that in the survey and we'll get back to you. And yeah, any questions that we didn't end up answering today, we'll also send that in a following email so people can get the answers for that. But yeah, thank you for joining us. I hope you guys all have a wonderful rest of your day and we'll talk to you all soon. Thank you.